Imagine breaking a leg and still needing an appointment to be seen. That's the reality for many Native Americans using Indian Health Service clinics in South Dakota.
A new effort between tribal leaders and state officials could be changing that, though. Beth Warden with our story here at 5.
Unless you rely on an IHS clinic, you may not understand what it can take to be seen by a medical professional. Representative Puri Purrier of Rapid City has seen it firsthand.
Enormity of the red tape that you have to go through to get care. I have relatives who died waiting to be seen in the emergency room.
In Wagner, there have been patients reporting to the IHS clinic to get referred who died in an ambulance on the way to the Wagner Hospital just 4 blocks away. In Sisseton, Tribal Chairman J. Garrett Renville remembers when there was a hospital for those on the Lake Traverse Reservation. Now it's booking an appointment at a clinic.
We're dealing with similar times like that for waiting to get in to see the doctor, and oftentimes to see anything quickly, we would have to be referred out.
And being referred out to another hospital can be up to several hours away. But there is a new concept, tribal managed care.
How do we use what we already know and adapt it and bring it to modern systems while also honoring our treaty obligations? And this is a perfect solution.
Full managed care, and South Dakota is one of the 12 or 13 left that hasn't fully switched over to say, hey, I think we can coordinate this care better for our populations. We know where they live, we know the disparities, we know where they need to go, and then we can do that.
A system provider would be hired by the tribe. Instead of billing the state Medicaid program, it would be a direct bill to the federal government. At a recent tribal state relations meeting, the state talked of funding a portion of the operation.
We can shift that focus from reacting to these health disparities to more of a preventing. And then we're going to see some real changes in these health disparities in tribal communities across the state.
The federal government would like to see every state move to a tribal managed health care system by the year 2030. In Sioux Falls, Beth Warden, Dakota News Now.
A one-time rural health care grant could also help fund the change in Native American health care. All 9 South Dakota tribes have the option of opting in to the program.